Namaste. I am Dr. R Unnithan, physician, Thangam Hospital, Palakkad. Today, I am going to discuss about the ancient healing methods for high blood pressure. You know, high blood pressure is a chronic degenerative disease. So, it is essential that our certain energy points has to be rejuvenated. Initially, we have to rejuvenate the 13 points in the body. So, first we will go into the points that has to be regenerated and then go to the Marma points. A few mentioning about the Acupressure points, Yogasana, Pranayama, Yoga Nidra, Mudras. So first we have to rejuvenate the internal organs. For that, initially the first point is, this is the umbilicus. 10 finger breaths from the umbilicus. You have to count with the fingers. 4, then another 2. You have to tap that point 3 times like this. 3 times. That is the first point. Second point is the umbilicus. You tap with these 3 fingers 3 times. Next point is the junction between the upper abdomen and chest. This point. Here also you tap 3 times. Next is the point. Here is the collarbone. The collarbone touches the shoulder. From below that there is a small depression. 4 finger breaths below that. That will come here. This point you tap 3 times. Then this is the throat pit. You tap 3 times. Then in between the eyebrows is the next point. You tap 3 times. Then you catch hold of the small projection here in front of the ear. This point. Tap 3 times, both sides. Okay. Then in the junction between the upper abdomen and the chest, take your middle finger here and the thumbs on this side, this point. These 2 points on the chest, you tap 3 times. Next is the midpoint between the arm, point of the arm, upper arm. This point on the inner side. Tap 3 times. Next, you take the middle point of the thigh on the inner side. Tap 3 times. Then the midpoint of the leg. Midpoint of the leg. Here, middle. Tap 3 times. Point of the leg. Here 3 times. Right? Then this is this point, that is 2.5 finger breaths from the web of the second and third toes. Here 3 times. So these are the points that has to be activated prior to energizing the Marma points. Next, we come to the Marma points for high blood pressure. The first one was already told for the Marma points for the this is for blood pressure also. That is, you see the midpoint of the heel, you take both the thumb and row it and come to this point. That is previously on base. This is 2.5 finger buds below the web of the second and third fingers. You press here. Come from here, both sides, and press here. Then the next point is on the left side. That is below this is the angle joint. This is the angle joint. Below the angle joint there is a dimple. You press both sides, the dimple, 10 times. Then is the point which was previously mentioned, that is the collarbone joins the shoulder here. Behind that there is a depression. 4 finger buds below the depression is this point. You press your hand like that and tap. Then this is the throat pit. Next point. 6 finger buds below the throat pit. This is the point. Press with the thumb 10 to 15 times. Then this is the throat pit. 1 finger bud below it on either side. Press 10 to 15 times. Then you know that this is the axilla. On the top of the axilla, you see the top of the axilla, you press the middle finger. Right? This is another point. Next, this is the meeting point of the axillary fold and the back. In between the top of this axilla and here is this point. In between the middle, you press outwards. Okay. Then between the top of the axilla and the chest, this fold of skin here on the chest, in the middle, you press 10-15 times. Then this fold of muscle you feel here, the junction between the axilla and the front of the chest. Press forwards 10 to 15 times. Right? So these are the points that has to be pressed for high blood pressure. One is here, 2 repeating, 2.5 finger buds below the second and third toe web. Start from the heel, midpoint of the heel, and press up. Next, is this is the bony prominence here, angle joint. behind it. On either side, press. Next, this is the depression behind the junction of the collarbone and shoulder. 4 fingers below it. On the left hand, you tap with the right hand. Then from the throat pit, 6 fingertips down. This is the point. Press with the thumb. Then from the throat pit, 1 fingertip below on either side of the breastbone. Press again. Then the center of the axilla. Next, between the center of the axilla and the junction of the axilla and the back of the body, the midpoint here. Then the midpoint between the center of the axilla and the front of the chest here. Then the axilla and the front of the chest, this junction. You press 10 to 15 times. Though these are the main Marma points for high blood pressure. Now I am mentioning a few points of acupressure of the hands. One is, the transverse lines you can see below the middle finger, in between the lines. This is one point. Here is one transverse line. Here is one transverse line. This is the middle finger, in between it. Press. Right. Then right from the center here, in the crease line is there. Press here in the center. Then 2.5 finger buds here. This is another point. 10-15 times you press. Then in a line with the little finger here on the inner side, press here. Then 2 finger buds below it, press. So in the hands, first is in a line with the middle finger between these transverse lines here. Then this is the center of the transverse line. Press here. Then 2.5 finger buds from here. This is another point. Then in a line with the little finger in the transverse line. Then 2 finger buds below it. There is another point. Then in the hand, in the legs, one is, see this right big toe, second toe, 2 finger buds above it. Okay. Right big toe, second toe, from the web here 2 finger buds above. Okay. Then from this bony prominence is here, take 5 finger breaths up here, it will come. Press here. Right. Then this is the knee joint. There is a bony prominence here. Just external to it, there is a small depression here. Press it 10 to 15 times. Again, 2 finger press from the web of big toe and second toe. Then from this bony prominence, you can see the inside. 5 fingertips above. Then this is the big bone of the leg, just lateral to it, external to it. There is a small dip. Press there. So these 3 points have to be pressed. Then you can press this point also. That is, you see the bone here and this tendon with this bony prominence and tendon midpoint. Here also you can press. Then most important is press the eyebrow center, middle of the eyebrow, with your 2 fingers, middle finger and forefinger. You make clockwise rotation, anti-clockwise rotation. Then actually 10 fingerprints from here, or else you can put the right hand just like the hood of a snake, place it at the anterior hairline, and here over the scalp you make sideways movements. This also you have to do. So these are the main acupressure points. Next is Yogasanas. For very high blood pressure, you need not know Surya Namaskar. For mild blood pressure, you can do Surya Namaskar 5 to 6 times per day. That should be very slow. You can learn the Yogasanas from a yoga master. Then the other asanas that are useful are Pavanmuktasana series, Vajrasana, Shavasana and Shashangasana. Then you have to do mudras. Mudras are mainly with the hands. The main mudras are, one is Jnana Mudra. You should do with both hands. Touch the tip of the thumb with the forefinger. Actually, each mudra has to be maintained for 45 minutes for the maximum benefit. Otherwise, you do according to your time schedule. Tip of the thumb touches the tip of the forefinger. Then Abhana Mudra. Tip of the thumb touches the middle and ring finger. This is the mudra. Tip of the tongue touches the tip of the middle and ring fingers. Next is Vayu Mudra. That is, the tip of the forefinger touches the base of the thumb and you hold the thumb this way. Tip of the thumb touches the base of the tip of the forefinger touches the base of the thumb and you hold the forefinger with the thumb. Next is Avan Vayu Mudra. That is, the forefinger touches the base of the thumb, you hold the thumb. You hold the forefinger with the thumb. Next, touch the tip of the thumb with the ring finger and middle finger. Little finger is free. This is good for reducing blood pressure, for heart disease, for acidity, and people having difficulty in breathing, you can walk like that it will decrease the difficulty in breathing. Then it's a special mudra, that is, you hold the fingers like that, and the right forefinger is held straight, and you have to hold the right forefinger with the right thumb with the left thumb. You interlock the fingers, hold the right forefinger straight, hold the thumb, right thumb with the left thumb. This will the best mudra for reducing the high blood pressure. Then there is another mudra also. You touch the base of the little finger with the on the left side, little finger with the left thumb. Hold it as a fist. You place over the knee such that it is 4 finger breadths away from the knee joint. Then you can exhale. And hold the, you close the right nostril and breathe through the nose. For this you inhale through the mouth. Then you close the left nostril, inhale through the mouth, exhale through the nostrils. You can do this on both sides 5 times at least. Then the people with high blood pressure, they should lie with their left nostril up. On the right lateral position you will lie, such that the right shoulder is down and the left shoulder is up and the left nostril is up. That will reduce the blood pressure. If the blood pressure is high, you can reduce it immediately by closing the right nostril, then placing the hands in the axilla, just like the yogis done. They keep it in the axilla. Otherwise, you can place your hands on the right axilla, close the right nostril, and breathe slowly through the left nostril. BP will come down immediately. So always lie on the right lateral position. Left nostril should be up. Then you have to, for any health problems, you have to do the pranayama. So the pranayama that is most useful is it is called as Aniloma Viloma Pranayama. If you are capable of holding breath, you can hold. First you close your right nostril, inhale through the left nostril, hold. Then exhale through the right nostril. Then inhale through the right nostril, close both the nostrils, exhale through the left nostril. There is a ratio 1:4:2. If you, for inhalation, you take 2 seconds. For holding, you take 8 seconds. And for exhalation, you take 4 seconds. If you find it difficult to hold the breath, just take inhalation and exhalation For example, 4 seconds for inhalation, 8 seconds for exhalation. That is enough. Next is Ujjayi Pranayama. That is, you touch the tip of the palate with the tongue like this. Close your mouth. Inhale through the nostrils, through both nostrils. Exhale slowly through both nostrils, just like that. That's the tip of the palate with the tongue. So this Ujjayi Pranayama is also very good for reducing the blood pressure. Then you have to do meditation. Most people will find it difficult to do meditation. So that the simple thing is meditation on breath. So you sit straight, hold your fingers in Jnana Mudra, that is, the tip of the thumb touches the tip of the forefinger. Place it over the knees. Head and spine should be erect. You inhale slowly and exhale slowly. You watch as you inhale, watch your breath coming through the nostrils, entering your throat and going to the lungs. As you exhale, watch the breath going from the lungs through the throat, through the nostrils to outside. Don't do forced breathing, just simply relaxed breathing. You can do it for 5 or 10 minutes. Another is mantras. For general health, you all do. You are all maybe chanting Mrityunjaya mantra and other mantras. But for strength, Adi Shankara's mantra is Him. You can chant Him. Let it enter through your crown of the head. The Sanskrit symbol should be followed. Let it enter the crown of the head, the Sanskrit symbol, and it enters the vertebral column and it spreads through the whole body. Him, 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 Him. Then there are 7 major chakra centers in the body, and of this the second center, Swadhisthana chakra. So that is mainly concerned with this blood circulation. So what you are to do is chant the mantra of Swadhisthana chakra. This chakra is situated. Then as you go down, you can feel the bone here in front, lower down on the abdomen. Exactly opposite that bone in the vertebra, you take that place. That is a Swadhisthana chakra. So imagine a 6-petaled, orange colored petaled lotus there. The center of the lotus is white. In the center of the lotus, in the white center, you chant Vam, the mantra Vam, V-A-M. Vam, 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 Vam. that is helpful in reducing the blood pressure. Then you have to do affirmations every day, because most of the time after you are branded as a hypertensive, you will always be under tension. While some people, while they are taking the blood pressure shoots up. So the mind has a definite connection. So you should, before going to bed and after getting up from the bed, you should always say, my blood pressure is normal, I am healthy. You have to 10 to 15 times before going to bed and soon after getting up from bed. 10 to 15 times you say. It has a definite effect in bringing down the blood pressure. Then the last is Yoga Nidra, or other is called as psychic sleep. So to that you have to lie down. Lie down on a mat in the floor, preferably. So if that is impossible, lie down in the bed. Feet should be 1 foot apart. The arms should rest on the floor. You take off the watch, spectacles and everything. And you lie down. You watch your breath. As you inhale, you watch the breath going through the nostrils, through the throat into the lungs. As you exhale, you watch the breath going out from the lungs, through the throat, through the nostrils. You take 4 or 5 deep breaths. You have to close your eyes. Now, watch your body parts. You become conscious and aware of your body parts. Right thumb, left thumb, left forefinger, left middle finger, left ring finger, left little finger, palm of left hand, then left lower arm, left upper arm, left buttocks, left thigh, left knee joint, left calf muscle, left leg, left ankle joint, upper part of the left foot, left big toe, second toe, third toe, fourth toe, little toe, sole of the foot. Then right thumb, right forefinger, right middle finger, right ring finger, right little finger, palm of the hand, right lower arm, right upper arm, right buttocks, right thigh, right knee joint, calf muscle, right leg, right ankle joint, right big toe, second toe, third toe, fourth toe, little toe, sole of the foot. Then aware of the genital area, lower back, middle back, upper back, both the shoulders, back of the neck, back of the head, crown of the head, forehead, ears, nose, eyes, face, mouth, front of the neck, chest, then upper abdomen, middle abdomen, lower abdomen. Now you continue inhale and exhale. Inhale and exhale. Inhale and exhale. As you inhale, energy comes through the center of the eyebrows and it enters, the energy centers in the vertebra and goes to the area opposite the umbilicus in the vertebra. It is called as Manipura area. As you inhale, the energy goes through the eyebrows to the Ajna chakra, then to the area opposite the umbilicus in the vertebra called Manipura. You continue to breathe. Now the Manipura area is energized. As you inhale, golden energy comes to the Manipura area. As you exhale, the golden streaks of energy go from the Manipura area in the heart and the blood vessel. As you inhale, golden energy accumulates in the Manipura area. As you exhale, the golden streaks of energy goes into your heart and the whole blood vessels. As you exhale, the golden streaks of energy goes into the heart and all your blood vessel. It cleanses all your blood vessels and makes it elastic, and there is free flow of blood vessels. You continue to breathe like that. Now your heart and blood vessels are energized. Your blood pressure has become normal. You are now perfectly healthy. Be in that bliss for a few moments. Now become aware of your body. Your body is lying on the floor. Become aware of your legs, upper limbs, chest, abdomen and head. You are aware of your body. You are aware of your surroundings, and now you are wide awake. Slowly open your eyes and relax yourself. Yoga Nidra is complete. Every day before you go to bed or when you are getting up, spend a few minutes in Yoga Nidra. Blood pressure will always be normal. So you have to practice this every day. Within a month, your blood pressure will become normal. So may God bless you and give you a healthy blissful life. Namaste.